USA, feeling anxious, stressed, fear of the unknown while studying for the PMHNP board certification? Well, you're not alone. My name is Dr. Lopez, and today I will crack the code, a little bit of a cracking of the code of the PMHNP board certification. This is part of our crash course review. Hi, you guys. Stuff that will be useful to you, stuff that you need to know. Take a note, subscribe to our channel, or even better, go to www.mpexamcoach, sign up to one of our courses, say goodbye to anxiety, and hello, PMHNP board certified. See you soon. Watch our channel. Bye. So the difference here, it was that it was added a medication that caused mania or depression. Okay, so be careful. If the patient is in mania state, is a lot different than contacting your CPC. So do you guys understand? There's two different concepts, very closely related, that will vary how you answer the question. So what are the medications that cause mania? By the way, this is something that I would put in my slides, right? In my cheat sheet, because I want to know that acronym for those. Medication cause mania. Steroid, anti-abuse could cause mania. INH, and antidepressant. Wait a minute. How can antidepressant cause mania? You guys already know this because that's one of my most important pet peeve. Someone with the underlying bipolar in a depressive phase, you don't recognize it, and you think this is a major depressive disorder because it looks like. Then you provide an SSRI. Now you could put the patient to mania. This is serious business. Now think about someone got an SNRI, which I see more often than an SSRI, got into a manic state, walked across the street, got hit by a car, there is an investigation, boom. Serious business. Not only because of the investigation, but because of the patient care, right? Not only because what happened to us, which is important, but at the end of the day, really, what's more important? The person no longer alive. Either way, bad outcome, super bad outcome, the worst possible outcome. Now, medication that could cause depression, steroids. Oh, so steroids can cause depression and mania? Yes. Another one, beta blocker. Why? Slow things down. Easy. Interferon. Okay. Accutane. When you hear Accutane, think of two. Two what? Think of two modes of pregnancy prevention because it could cause birth defects. So Accutane not only causes depression, but could cause birth defect. Think of two things you need. Very important. Okay. In fact, I got a few weeks ago, like maybe 2 months ago, one of the dermatologists, he called me and said, "Hey, I'm taking care of one of your patients. I'm starting him on Accutane." I was like, "Wow, thank you. I really appreciate you calling me to let me know." Right. He's like, "Yeah, I just didn't want to interfere too much with your treatment." Okay, guys, 1 second. She wanted to give me a kiss. I'm sorry. Okay, sorry about that, guys. So, my apologies. So, my little girl, she likes to kiss him every morning. So,
No
okay,
apologies needed.
all right.
Family's always best.
Yes, at 6 o'clock in the morning, she wakes up early with me. She's an early riser. So, antiviral medications could cause depression. Drugs that patients with cancer, right? They are puking all over the place too. Those could again cause depression. Benzos could cause depression. Progesterone, very important one. Okay, progesterone could cause depression, and you need to know whether it was the drug that was added or is this an inducer or inhibitor. Most of the time, you differentiate by saying the patient was stable, with, it may not say stable. It may say has been on the medication for 6 months. That same thing as stable, right? With no difference. Everything was the same, right? And then something was added. So now be careful, because they'll say, the first thing they'll say is increase the dose, decrease the dose. And then option C, this is how I would put it. I would put the two baits first, because that's catches your eyes. Now you're thinking one is going up, one's going down. We know how most of you guys think. This was important, that knowing and kind of knowing is the divisor of the water here. Okay, don't want to go too much into this, but steroids could also cause both, right? So what else do we got here? Also, steroids could cause psychosis.
Hey there. What if I could tell you exactly what is going to be on your psychiatric nurse practitioner board? Well, not exactly. We look at the blueprint, the ANCC blueprint. We look what is important, the topics that will likely be on your psychiatric nurse practitioner. We break it down, make it easy to understand with recorded and live content, unlimited question banks, diagnostic tests, study group, full support, Sunday through Sunday. We are here for you. We make it super easy at a super low price. Use the code now, and get a special discount while it is valid. My name is Dr. Lopez, and I will help you pass the psychiatric nurse practitioner board examination. See you soon.